Thank you, Amanda. The next presentation will be by Sharyn Worrall, who is Area Vice President at Komodo Health, and she will give us an update on the cholangiocarcinoma cohort of the Komodo project.
Hi, everyone. It's a real pleasure to be here today and to provide some updates on the partnership that Komodo Health has with the Cholangiocarcinoma Foundation. So thank you for inviting us to be here. Before I start, I really would like to, again, thank the foundation and also thank my colleague, Dr. Melissa Agnello, who works incredibly closely with the entire team here at the foundation. We're going on about a 5-year partnership with the Cholangiocarcinoma Foundation, and just really looking forward to that ongoing work. Not entirely sure, let's see. All right, there we go. So I'll kick us off today by talking briefly about Komodo Health and our healthcare map. Komodo Health has been transforming healthcare since 2014, and the company is a mission-driven company. Our mission is to reduce the burden of disease. And we're doing this by building a data set that represents the most comprehensive view of the healthcare system today. The co-founders had been working in the healthcare data space and realized that the data has many barriers to use. So not standardized, it's really siloed, hard to access, and they realized that there needs to be a better way to get these data together so that they can be more useful for researchers and the healthcare system in general. So that was around 9 years ago. Today, we have over 130 healthcare partners and customers in the life sciences. We have more than 15 patient advocacy organizations who we work closely with, in addition to several academic research institutions. All of these folks are leveraging Komodo's healthcare map to drive programs and ultimately help patients. We refer to our data set as the healthcare map. It's Komodo's goal to create a single source of truth as it relates to what's going on the ground floor of healthcare on a national level. We do this by bringing together thousands of siloed data sources, and linking them together to create a single version of truth from all of that disparate data. So the main source of the data is based on medical claims, but the healthcare map is layered, allowing us to continue to add on different types of data to provide more depth to the longitudinal data that we have. So we're constantly building upon it. The data is patient level, and we're able to really see those longitudinal patient journeys. So each encounter that these patients have in the healthcare system, we're able to capture and link together. This provides incredible visibility into the odyssey that many patients are experiencing through the healthcare ecosystem, from diagnosis and treatment and beyond. We do all of this de-identified. All of the patient identifiable information is stripped before it arrives to Komodo Health. And just really over the years, we've built this extremely representative, census-level, comprehensive data set that's actionable, timely. And I think what also is really important is that it's always expanding. So it's not a stagnant data set. It's evolving and growing every day. So about our partnership with Cholangiocarcinoma Foundation, it began in 2018. They were our first nonprofit partner in the advocacy space, and they continue to be really incredible partners who are pushing the narrative forward. The partnership enables the foundation to have a nearly real-time and comprehensive picture of the patient landscape. Our goal is to ensure that our data are accessible and easy to leverage by the foundation's team, and also to work in partnership with them to answer some of their most pressing questions. So some of the initial projects that we worked on with the foundation are still up and running today. The team uses data-driven intelligence from the healthcare map to help patients find specialists and care networks that have the most experience treating cholangiocarcinoma patients. So this includes high-volume treaters who are involved in publications and trials in cholangiocarcinoma, and who also have a broad healthcare provider referral network. These HCPs, these physicians, are funneled into the Foundation's specialist map that lives on their website, where patients can interact with that map to find providers quickly in their area. Cholangiocarcinoma Foundation is also using this technology to proactively spot gaps in care where physicians might not be meeting benchmark standards of care around biomarker testing for cholangiocarcinoma tumors. The team also worked on a project to uncover the amount of time that typically elapses from first diagnosis to first biomarker test and how that might differ across community and academic centers. What was uncovered was that in the time frame from 2017 to 2020, there was 54 days was the median amount of time between first diagnosis and first biomarker test, and it was not statistically significant between the academic and the community centers. And finally, the data access really has helped the Foundation's team as they expand their network of researchers working to reduce the burden of cholangiocarcinoma and to find providers that are seeing newly diagnosed patients. This is really critical in helping patients be able to access the educational support offered by the organization at this vulnerable time of diagnosis. Oops, excuse me. So there are a lot of questions that the Foundation team has presented to Komodo Health over the past year, and I have them listed here on the slide. These are the types of questions that the Foundation knows to be important and questions that we have worked to address with the Foundation. So what proportion of cholangiocarcinoma patients have comorbid autoimmune disorders? What proportion of cholangiocarcinoma patients have a history of GI disorders such as IBD? How many patients are diagnosed with cancer of unknown primary origin before being diagnosed with cholangiocarcinoma? And how does patient race and ethnicity affect outcomes? So you can see for that third question, we ran an analysis that showed that 23% of patients diagnosed with cholangiocarcinoma from 2018 to 2022 did have a diagnosis of cancer of unknown primary in the 2 years prior. So as it relates to the first question, CCF came to us inquiring about autoimmune disorders to assess if and how exclusion criteria may affect cholangiocarcinoma patients living with these disorders who are looking for clinical trials. Exclusion criteria for novel therapies might exclude patients with autoimmune disorders, so the Foundation wanted to have a good understanding of how many patients could potentially be affected. We ran a high-level analysis of all cholangiocarcinoma patients over a 5-year time frame to uncover the number of patients with autoimmune disorders. We saw around 16.3% had inflammatory bowel disease, around 3% ulcerative colitis, 1.5% Crohn's, and 2.5% primary sclerosing cholangitis. And the percent of cholangiocarcinoma patients with any autoimmune disorder, which included things like IBD, PSC, alopecia, fibromyalgia, and others, was around 34%. So how does race and ethnicity affect outcomes? This is another question that we've been exploring with the Foundation. Race and ethnicity is a valuable patient characteristic, really, for identifying and addressing healthcare disparities. Similar to the way we trace patients' journeys through the lens of medical and pharmacy claims history, the patient's racial and ethnic background provides additional rich contextualization that allows for a deeper appreciation for factors that might contribute to disease. So to better address healthcare disparities, we at Komodo Health have integrated race and ethnicity insights into our healthcare map. And for the foundation, this is providing important information to help guide programs to create a more equitable healthcare experience and outcomes for patients of color. We are working with the team to identify pockets of the country that have higher percentages of patients of color and to begin to work toward health equity, again, through programs, clinical trials, and other initiatives. And the slide here, we have a 2-year time period listed, so between January 2021 to December 2022, and the distribution of race and ethnicity in those 2 cohorts. So Komodo's partnership with Cholangiocarcinoma Foundation really continues to grow with an aggressive approach that's needed to tackle this disease. In addition to maintaining the current projects and workflows embedded into the foundation, we look forward to the opportunity to explore and find answers to the foundation's most pressing questions. Now, this includes further investigation of autoimmune disorders and cholangiocarcinoma, perhaps rerunning biomarker analysis to see how things have changed from that previous cohort, that previous analysis to today. The second bullet here on the slide really is a foundational step that we need to take. We do need a clearer understanding of the burden of disease of cholangiocarcinoma, really to effectively address the problem. You can't change something if you can't measure it or if you don't have a baseline. So one project we may be exploring is an analysis of newly diagnosed patients, including patient demographics and their risk factors over a yearly time period. And then utilizing Komodo's solutions and data to continue to support healthcare provider education efforts and outreach. Again, really to ensure patients are getting connected to the Cholangiocarcinoma Foundation for support, and that healthcare providers can find updates on the latest research in the field. So while we've been working with the foundation for several years, we are continuing to uncover new opportunities to help patients and foresee a really exciting year ahead. So in conclusion, I want to thank the entire Komodo team who has worked on any project with the Cholangiocarcinoma Foundation. And again, Dr. Agnello, who is really close with the foundation and their projects. And of course, would love to thank our partners at the Cholangiocarcinoma Foundation, Stacy, for your partnership, for everyone's dedication and passion for this work. It's been a pleasure to be working with you, and we look forward to continuing the partnership. Thank you.